Welcome. Today we are going to talk about triggers. While not the same as a trigger on a gun, triggers are powerful stimuli that lead to an emotional reaction. This reaction can be solely internal where outsiders do not know it has affected you, or it can be a negative reaction such as rage, which is dangerous. Why is it dangerous? It can be dangerous depending on the person and the situation. Someone that practices anger management can, guess what? Yes, manage their emotions, manage their anger as we all have anger at times. It is a normal human emotion. Now let's go further into triggers. The anatomy of a trigger, the neurobiological perspective. To understand why we react the way we do, we must first define what a trigger is from a psychological and biological standpoint. An emotional trigger is an external stimulus, a word, a smell, a situation, that precipitates an intense emotional or psychological response. These responses are often disproportional to the current event because they are deeply rooted in past trauma, significant stress, or unprocessed memories. The biological hijack. The human brain is hardwired for survival. When you encounter a trigger, your amygdala, the brain's emotional alarm system, processes the information milliseconds before the prefrontal cortex, the seat of rational thought, can even interpret the situation. The amygdala's role, it initiates a stress response, signaling the hypothalamus to release a cascade of hormones including cortisol and adrenaline. Physical manifestations. This results in increased heart rate, sweating, racing thoughts, and muscle tension. The offline rational brain. During a trigger response, activity in the prefrontal cortex decreases, making logical thinking and self-control nearly impossible in the heat of the moment. 2. Examples of common triggers. Triggers are intensely personal and vary based on individual history, yet they often fall into several identifiable categories. 1. Interpersonal and relationship triggers. These are often rooted in attachment theory and past interactions with loved ones. Criticism or rejection. Feedback that suggests inadequacy can trigger defensiveness. Abandonment. Cues. Signs that a partner is pulling away or not responding to a text can feel like a deep betrayal. Feeling misunderstood. When emotional needs are missed, it can trigger intense frustration or sadness. 2. Workplace and professional triggers. The office environment is a frequent source of ego protection triggers. Micromanagement. Excessive monitoring can trigger feelings of lack of autonomy and decreased morale. Office politics. Navigating complex social dynamics or feeling unrecognized for your work can cause stress and irritability. Deadline pressure. Tight timelines trigger a sense of urgency that can impair decision-making. 3. Sensory and behavioral triggers. Sensory input. Specific smells, sounds, like a door slamming, or even a certain tone of voice can activate memory networks connected to past trauma. Sudden changes. Unpredictable changes in plans can cause intense anxiety for those who grew up in unstable environments. 3. The mistake of avoidance-only strategies. A common, but ultimately flawed, reaction to being triggered is behavioral or emotional avoidance. Avoidance describes any action designed to prevent an uncomfortable emotion or situation from occurring. The reinforcement cycle. While avoidance provides temporary relief, it creates a vicious cycle. Reinforcing fear. By steering clear of reminders, the brain never learns that it can handle the distress or that the situation is no longer dangerous. Worsening symptoms. Studies show that chronic avoidance can actually make PTSD and anxiety symptoms worse over time. Generalized impact. Avoidance often spreads to other areas of life, leading to social isolation, decreased quality of life, and a disconnect from one's own feelings. Emotional mastery requires walking toward the emotions rather than running from them, often through processed regulation in a safe environment. 4. Aggressive reactions versus the regret cycle. When the prefrontal cortex fails to step in, anger often spills over into aggression. Anger is an internal state. Aggression is an external, often harmful behavior. The mechanics of overreaction. Aggressive reactions can be reactive aggression, Impulsive, emotion-driven acts like shouting, slamming doors, or snapping at a loved one. Passive aggression, sarcasm, or the silent treatment intended to hurt without being direct. The weight of regret, the emotional hangover after an overreaction, is marked by deep regret and shame. Strained relationships. Partners may feel they must walk on eggshells, which erodes intimacy. Professional damage. Frequent reactivity at work can limit career growth and lead to burnout. Psychological toll. Regret amplifies anxiety and reduces overall well-being, making everyday challenges feel even more overwhelming. Free.
Dealing with emotional triggers effectively requires a shift from automatic reactivity to intentional awareness. Best practices focus on immediate sensory grounding to calm the nervous system, followed by cognitive tools to reframe the underlying thoughts and patterns. 1. Immediate de-escalation, sensory grounding. When a trigger occurs, the brain's alarm system, the amygdala, often overrides rational thought, leading to a neurological hijack. The first best practice is to anchor your senses in the present moment to signal safety to your nervous system. The 5-4-3-2-1 technique. This is a gold standard grounding tool that distracts from racing thoughts and reorients you to reality. Identify 5 things you can see, e.g., a clock, a tree, a chair. Acknowledge 4 things you can touch, e.g., your shirt, a smooth table, the floor. Listen for 3 sounds, e.g., distant traffic, a hum, your breath. Detect 2 scents, e.g., coffee, a candle, fresh air. Identify 1 thing you can taste, e.g., the lingering flavor of mint or water. Paced breathing, engaging the parasympathetic nervous system through deep belly breathing, such as inhaling for 4 seconds and exhaling for 6, lowers your heart rate and reduces the flood of stress hormones. Tip skills. Utilize temperature by splashing cold water on your face to provide an immediate physical shock that can interrupt an anxiety spiral. 2. Cognitive tools, moving toward mastery. Once the initial physiological intensity has lowered, best practices involve getting the prefrontal cortex back into the driver's seat to choose a more objective response. Name it to tame it. Labeling the specific emotion, e.g., saying I am feeling rejected instead of I am angry, creates distance between yourself and the emotion, allowing it to be viewed as a temporary experience rather than an identity. Cognitive restructuring. Challenge automatic negative thoughts by looking for evidence. Ask, is there another neutral or positive interpretation of this situation? Or, what would I say to a friend in this position? Historical mapping. Trace the current reaction back through your history to see if it connects to past experiences or childhood narratives, e.g., a critical parent triggering current defensiveness. This helps validate that the reaction is a meaningful response to the past rather than a current character flaw. 3. The avoidance trap. A critical best practice is realizing that avoidance is not a long-term solution. While steering clear of triggers provides temporary relief, it often reinforces fear and prevents the brain from learning that the threat is no longer real. Maladaptive vicious cycle. Chronic avoidance tells the brain the perceived danger is real, which can eventually lead to increased anxiety, social withdrawal, and reduced quality of life. Exposure. Practice. Effective healing often involves learning to tolerate and work through difficult emotions in a safe, controlled way, rather than eliminating all triggers. 4. Best practices in high-stakes environments. In the workplace or high-conflict relationships, proactive emotional regulation involves setting strategic intentions before a trigger occurs. Set emotional intentions. Before a difficult meeting, write down 3 words for how you want to show up, e.g., calm, clear, powerful, to help stay grounded during stress. Use open-ended questions. If frustration rises, buy time by asking a collaborative question like, what other options have we considered, instead of making a reactive statement. Self-compassion phrases. Use grounding affirmations like, this is a moment of suffering and I can be kind to myself to prevent the shame spiral that often follows a trigger.